beauty mark piercings, Madonas, Monroes, what you should know before you get one done. Coming up next on Consultations by a Piercer, episode number 31. First off, for those that are new here at the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and etc. But you might not know who this feller is with the terrible haircut. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Piercing we're going to talk about today is called a beauty mark. It goes by basically 3 names, sometimes 4 names, sometimes 5 names. It is a piercing done on the upper lip, done to the outside of the philtrum, that thing in the center. Usually done on the edge of the nose or nostril, right at the edge of the nostrils. Done with a labret stud, which is a flat back piece of jewelry with a flat back disc in the inside and a setting of some type like ball or gem or what have you on the outside. Traditionally, if this is done on the left side, it's called a Monroe. If it's done on the right side, it's called a Madonna. However, if you go in and ask for a Monroe or a Madonna, they're still going to ask you which side you want to put it on because oftentimes the internet is wrong. Average healing time on this is roughly anywhere from 8 to 12 weeks, during which time you want to clean twice daily using a sterile saline spray. Personally, I like Neil Med's Piercing Aftercare because it comes out in a fine mist. However, if you can't find that, you can find comparable stuff. The biggest things you want to look for, it should be a pressurized can. It should say sterile on that can. And when you turn it over and look at the ingredients, it should only say water and sodium chloride or salt. Nothing else. Now, how that spray delivers, it can affect how you use it. If it comes out in a fine mist, just spray it directly on the outside, leave it alone. Let it sit on there for about 5 minutes and then pat it dry. If it comes out in a stream, kind of like a squirt gun, that's going to be kind of wasteful and hurt to have it applied like that. So what I would suggest doing is getting a sterile piece of gauze sponge, or if you don't have that, a clean paper towel can work. Fold it up, saturate it with the spray so it's damp, lay it against the piercing for roughly about 5 minutes, doing a cold compress, and then just blot it dry afterwards. The other thing I suggest doing is at the end of your shower, pull your hair and everything out of the way if you have hair, unlike me, and then just let the water flow over the area for about 30 seconds. What we're doing, that you only have to do once a day, the saline twice daily. What we're doing with those things is we're trying to removing that limp discharge, that crusty, the stuff that hardens, collects on the jewelry. Because when the jewelry shifts or moves, when you're talking and moving your mouth and etc., it can agitate it if we don't remove that. So it makes it feel better and it, looks better and it doesn't agitate the piercing and cause problems. So that's why we want it off there. Now, if you have an obsessive amount of this or it doesn't seem like it wants to come off, I suggest going to see your piercer and have them take a look at it and clean it for you. Don't run to the medicine cabinet and start pulling out every object you could possibly fit in there to dig that crusty off. You're probably going to cause more damage than good. And chances are is if you see an obsessive amount or it doesn't seem like it wants to come off there might be something else going on that needs to be addressed. So it's a good idea to have your piercer check the piercing anyway. Now, you do that part twice a day, and twice a day with the saline, once a day with the shower for the next 8 to 12 weeks, or until you stop seeing the discharge collecting and depositing on the jewelry, and the piercing hole will kind of indent or ingrown. For the inside, I suggest for the first 2 weeks only, rinsing twice daily using a alcohol-free antiseptic mouthwash such as Biotine. 30 seconds twice daily is more than enough. Do not rinse 50 times a day. There's no point to that. The other thing you can do is warm saltwater rinses. Basically, a cup of distilled water is best for an 1/8, and then drop in an 1/8 of a teaspoon of sea salt. Let it dissolve. Tastes about as salty as your own tears. Rinse with that off and on for a few minutes. Once or twice a day is fine. Sometimes it feels good, so maybe doing it an additional time, it's not going to hurt anything, and it's probably going to feel better. Kind of soothe it. Now it's time to move on to all those things you don't want to do. Cross-contamination prevention. Common sense stuff. Wash your hands before you handle it. The only time you have any contact with the piercing is when you're cleaning it. The rest of the time, leave it alone. No oral contact, deep mouth kissing, or sexual contact, as in oral sex, for a minimum of 8 weeks. Understand you are more acceptable to STDs during oral sex, even after the piercing is healed. So practice safe sex the way you're supposed to. Latex barrier. Do not stick unclean objects in your mouth, like pin caps, toothpicks, rusty nails, sticks you found on the ground, poop. I don't understand why everybody thinks it's okay to put things in their mouth. Don't do that. You're not 2. You don't need to explore the world with your mouth anymore. Actually, it's younger than 2. Anyway, speaking of sticking unclean objects in your mouth, do not share food items or utensils with other people. Make sure that your own utensils are cleaned on a regular basis. It's not a bad idea to start with a fresh toothbrush the day of the piercing, just to be on the safe side. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with that piercing needs to be cleaned on a regular basis. Do not swim. Do not submerge the piercing in bodies of water you can't control the quality of, which is pretty much everything but your own clean bathtub. Understand, I know you're going to see a lot of conflicting ideas on this one. Here's how it really is. Any body of water that is large enough for you to completely submerge your body in and move around is probably going to contain a large quantity of microorganisms. Those microorganisms can work their way into an open wound. What is a piercing during the healing period? It's an open wound. So understand, every time you swim, every time you submerge that fresh piercing in that body of water, you are at risk of causing an infection. Keep pets away from it. Don't let them sleep in the bed with you, especially smaller animals that like to sleep up by your face. Trauma, swelling, and abuse. Do not sleep on the piercing. This one's a little difficult to do that, but I guess it's possible because I'm sure there's somebody out there that's done it. Try to make sure that it's elevated off the bed. Make sure that it doesn't have any contact with the pillow. Do not spin, rotate, move, play with the piercing. Dig at it. Grow it, even mess around. Leave it alone. All those things are going to prolong your swelling and possibly lead to prolonged healing and other issues. Now, eating and etc. can affect how much swelling you see in that first week or so. Generally, we suggest swelling with these can last anywhere from 3 to 5 days. Usually, sometimes it doesn't happen until the second morning. You can greatly reduce the amount of swelling by cutting down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, or anything that may agitate your mouth, including vaping. Also, stay away from carbonated beverages or beverages that contain, or food that contains a lot of salt. All those things lead to more swelling. Biggest thing you want to remember is if it hurts to ingest something, don't ingest it, because chances are it's going to cause some inflammation and some swelling or prolong the swelling. Foods that are easiest to eat are soft foods, things like yogurt, ice cream, smoothies, sports or nutritional shakes, baby food, applesauce. Think of anything you can just put in your mouth and swallow, and that's probably going to be your best option for the first day or two. This doesn't affect piercing or eating as much as, say, a tongue piercing does, but it can be a little awkward at first and take a little bit of getting used to, and movement of your mouth is painful in some cases. So kind of take it easy at first until you adapt to having the jewelry there and you get past that initial ouchy phase. Other ways you can reduce swelling: cold items. I generally suggest after leaving the studio, hit a convenience store and buy a giant tub-sized glass or cup full of crushed ice and gently suck on that for the first 24 to 28 hours. Also, drinking lots of cold liquids, especially throughout the night. Normally, we see the worst of the swelling first thing in the morning, and that's partly because your body dehydrates at night. During the night, if you can get up and get a couple glasses of water or have some ice water next to the bed and take a couple sips, it's going to help reduce the amount of swelling by keeping you hydrated. Another thing that will help is sleeping with your head above your heart. Some of us can do that, some of us can't, but if you can sleep with your head elevated, that's going to help reduce the swelling. Now, as far as over-the-counter anti-inflammatories like ibuprofen, etc., if you've not had issues with it in the past, it shouldn't present a problem. However, whenever in doubt, contact your physician, especially if you're on any other medications or have any pre-existing health conditions that may be affected by taking those medications. Now, as far as eating at first, take your time. wean yourself onto solid foods. I've had some clients, they're saying by the third day they were eating cheeseburgers and fries. I've had other clients that said it took a week or two to get to that point. Just take your time. Start with kind of simple things that you can kind of cut up into pieces and shove into your mouth, and try to avoid really complicated things where there's lots of different textures. So simple at first, and then slowly work your way up. It may be a little frustrating at first, but eventually it's going to get to the point where it feels second nature to have that jewelry in there, and it's going to feel stranger to have it out than to have it in. Now, we should talk about the risks. There are 3 major risks that are attributed to any oral piercing that you get done, and that is enamel erosion, gum erosion, and softening of the bones inside your mouth. This piercing it's mainly gum erosion, because it can be in contact, especially if you don't downsize the jewelry. The other risk is swallowing jewelry. This one's a little bit on the lower side than, say, a tongue piercing or something that's a little bit more in that area that it's hard to detect. You do want to check the tightness of the balls just to be on a regular basis, or the end, basically because you do not want to swallow this jewelry. Now let's talk about placement, angle, and jewelry type. It should be done, in my opinion, always above the gum line, but you can get away with it, some people, of doing it below the gum line. It really depends on where your teeth are and how much movement there is in your upper lip. Usually place off to the side and just outside of the end of the nostril or the edge of the nostril. If you are going to get multiple groupings, like say you're going to get canine bites or angel bites, I suggest marking it all out the first time, even if you're just getting one done that day. And the reason being is kind of to get an idea of how it's going to look and work on the face. Now, it's not going to be uncommon for your piercer to make you make funny faces. And this is to determine how much movement and how that piercing is going to look with different expressions, and also to notice how much movement up and down your upper lip has. And when you look at the markings in the mirror, I would suggest doing the same thing, just to give yourself an idea of how it's going to look and how it's going to move with your facial structure. Lastly, this should be done with a labrae stud. Now, labrae stud is has a flat round disc in the back, and then a post, and then usually something that threads onto the outside. I don't suggest threadless. It's possible. They're just not quite as secure. Most cases, threaded jewelry is going to be what you're going to find with this one, usually 16 gauge or thicker. Now, you are going to need to downsize because we're going to oversize the jewelry to allow for swelling. And I usually suggest downsizing in anywhere from 4 to 6 weeks, unless you're starting to have problems with that jewelry catching or coming in contact with your gums. Now let's talk about the piercing experience, pain, etc. Usually most people on a scale of 1 to 10 say this is about a 2 or a 4, right in there and just kind of right in the middle if 10 was the most painful. It should be pierced from the outside inward, not the other way. The method that most piercers use is they pierce inward, or they clamp it with a set of Pennington forceps, which are kind of uncomfortable, inject the needle in and through, and then remove the forceps, push the needle out with what is called a guide pin. It is a tapered piece of wire that one side is threaded or threadless so that the jewelry can be connected to it. So we push the needle out, then thread that jewelry on the inside, push it out, unthread the guide post, thread the end on, and we're done. This can cause a couple of things to happen. First off, it does make the process slightly longer. It can be a little more complicated for that reason. Also, because we make that when we do the piercing, it's usually a hole that's exactly the thickness of the jewelry we're putting in there. But when we put that guide pin in, it's tapered, so meaning it's thinner on one side than it is the other side. Sometimes if we have to push it out a bit far to get that jewelry threaded on there, it'll bleed a little bit. So it's not uncommon afterwards to maybe have a little bit of bleeding during the process. You really don't see a lot of bleeding afterwards, unless we nick a blood vessel, which happens from time to time. But this one isn't really prone to a lot of bleeding, other than during the healing or during the piercing process. Now, understand that getting the jewelry in and getting the end on is probably the thing that's going to last the longest. Aftermath, you're going to see a little bit of throbbing and aching. That'll usually last a few minutes. Then it's going to be tender to the touch. If you bump it, you're going to know it. Also, there might be some slight bleeding, as I mentioned earlier. That's pretty rare, but it can happen. Talking, eating, drinking will be probably uncomfortable, so think of that beforehand and plan ahead for that. It may take a little while to adapt to that jewelry because it's so long. And now the other thing is a lot of times people look at this and think the angle is wrong because we try to match the angle of the inside of your mouth. And sometimes that'll cause it to look like it's tilted upward a little bit. Understand that post's a lot longer, so it's going to over-exaggerate the angle. Once you go to the shorter one, it's probably going to tighten up and look a lot more straight or match what your envision was. So don't be surprised you get up and you look in the mirror and go, oh, this thing's really long and I don't like the way it looks. Give it some time, especially wait until you downsize because you're going to really probably like it once it downsizes. As far as anatomy, most people have the correct anatomy for this. If you have an upper lip, you can probably get this done. The only time I would probably be apt to not want to do it is if it's a situation where there's no way to position the jewelry so that it's above the gum line or below the gum line. That's the only time I'd say no on this particular piercing. Now let's finish off with what you should consider. First off, this will affect eating and drinking and etc. So it's a good idea to go out and purchase all that stuff in advance, have that soft food on hand and all that easy stuff to eat instead of having to run around and do it the day of. Downsizing the jewelry. I don't know how to stress it's going to look better, it's going to feel better, it's going to not knock against your teeth as much. The other thing it'll cause usually is a little bit of nesting. Nesting concerns people, and what nesting is where the disc will make kind of an indentation in the back, which actually kind of pulls the jewelry further away from the gums, which ends up with less risk, and it tends to be more comfortable. This usually doesn't happen until after you downsize. Now, downsizing, usually the back is the only part we replace. We usually keep the front, so you don't have to buy a whole piece of jewelry, and we usually cut you a deal. Most piercers are either downsize for free or will just charge you for the post itself at a discounted rate because they want you to downsize because it looks better and you're going to be less likely to have problems. So that's our end goal here. Now, some things you want to consider also is if you have any upcoming dinners or talking events or somewhere that you're going to have to do a lot of talking, you probably want to wait until after that's done. Understand also that if you have a job where you talk a lot, it's best to get this done when you don't have to be into work for a few days, like the beginning of a 3-day weekend. This is going to affect it, and the more you talk, the more swelling you generally see, so the more uncomfortable you're going to be. So it's best, if you can, to just kind of cool out for 2-3 days. Hobbies and organized sports and other organized activities. If you are involved in something and there's a dress code, and that includes employment, chances are it's going to say that you can't have this piercing. You can't have visible piercings while competing or participating or what have you. Talk to your coach or whoever's in charge, read the rule book, all that fun stuff before getting the piercing done. Don't get the piercing done and expect to just walk in and everything's going to be fine and dandy and they're not going to care. Or do this thing where you're going to just take it out long enough for the game and then put it back in, because both of those things are going to probably lead to you losing the piercing or a whole load of problems. You don't want to be faced with a situation where it's either go home or take the jewelry out. As far as work, talk to your boss before you get it done. Well, that's pretty much everything I have to say about beauty mark piercings. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care and enjoy this next video.